Hello, I'm Brendan Mill, and tonight on this abbreviated version of 60 Minutes, we'll be talking about an extremely pressing but somewhat unknown question. What is the healthcare situation in Afghanistan? The war in Afghanistan gets a lot of attention, but the peoples whose lives are directly affected by this conflict are regularly disregarded. With so much turmoil in the area, you would expect healthcare to be a major issue. The extent of this issue is rarely brought to light. According to the website The Cost of War, because of the recent conflicts, 21,000 civilians have died, and an estimated 20.4 million people in Afghanistan have a mental disorder, most commonly depression or PTSD. Heather Barr, the senior researcher for Human Rights Watch, stated,
And I think that what's really concerning is the statistic that Chris cited about how the number of people seeking services has doubled in the last year. I think this is an indication of something really disturbing which is happening now, which is that having made some progress, having learned some good lessons and some bad lessons along the way, rather than sort of building on that and looking at why have things not worked that well, how can we improve it, how can we sustain the progress that has happened, there's much more of a desire to just walk away and say, well, we did what we could and it's up to the Afghans now. And I think that would really be a tragedy.
Yeah, but Heather, isn't that proof then that this was never about the Afghan people? This was about geopolitics, and that's just how it's going to be.
Heather stated, the problem in Afghanistan with healthcare is so complicated and so tough that many foreign aid policies and governments, such as the United States, are just giving up on the problem as a whole. After years of communist, then Taliban rule, the healthcare system has been left in shambles. According to the World Health Organization, the infant mortality rate is 70 deaths in 1,000 births, and the under 5 mortality rate is 257 deaths per 1,000 children. This puts Afghanistan third around the world for highest under 5 mortality rate, behind Angola and Sierra Leone. On the Human Development Report from Afghanistan by the World Health Organization, Afghanistan scores a far behind on eradicate extreme poverty and hunger, promote gender equality, and reduce child mortality. They did not measure a score on achieve universal primary education, improve maternal health, combat HIV/AIDS, ensure environmental sustainability, global partnership, and development. Tonight, we will hear from an inside source on the issue, Dr. Kadrat Mohadidi, who works as a volunteer doctor in the area. Dr. Mohadidi grew up in Afghanistan but moved to America. He got a doctorate degree in medicine in America and now works in the U.S., but sometimes will take time to go back to Afghanistan to help his fellow Afghans. He was recently featured in a documentary titled Motherland Afghanistan, which was filmed by his daughter. We will use this experience through the documentary to show you the struggles these people face on an everyday basis. To begin with, money is a large part of the problem. Most people don't live near hospitals. For example, Dr. Mohadidi worked briefly at a rural hospital in the heart of Afghanistan. When he was talking with some of his patients, he learned that people travel for days to reach the hospital. This lack of hospitals in Afghanistan is another major problem. Secondly, people have to pay for their own surgical materials. While such an idea is completely foreign to un-Americans, it is a common and dangerous practice in Afghanistan. People need to buy everything from surgical gowns to the surgical stitches used to sew them back together. When people are poor and can't afford the high-end regulation medical supplies, they turn to second-rate materials sold from shady vendors. This problem was expressed through one of the surgeries performed by Dr. Mohadidi. He tried to use the stitches the woman gave him, but he found the stitches were extremely poor and kept breaking. This is just an example of the problem a system like this introduces. Never mind the fact people have to pay for these expensive hospital visits when, according to the Asia Times, the average Afghan earns $1.17 a day. The next biggest problem facing healthcare in Afghanistan is the education level of Afghans. After the communists invaded Afghanistan, they dealt swiftly with many of the colleges and universities in place. After the communists left, they left in their wake a generation of Afghan doctors who had not received proper training to take care of the wounded and sick. In his experiences in Afghanistan, it is easy to see how sad and frustrated Dr. Mohadidi is with the undereducated doctors who were supposed to learn from him. Multiple times, the doctors make big mistakes while tending to patients, and Dr. Mohadidi becomes flabbergasted that supposed doctors will make these silly mistakes. Along with the undereducated doctors is the undereducation of the public in whole. In Afghanistan, radical medical ideas clash with deep traditional religious beliefs. For example, Dr. Mohadidi was presented with a pregnant woman who was unconscious. Her parents told the doctor that their daughter had begun to have seizures. They believed she was possessed, so they brought her to a religious healer, who attempted to beat the evil spirit out of her by hitting her repeatedly and strangling her. While the woman eventually was revived, her baby had died due to the aggressive beatings by the healer. The damage the communists did to the education structure in Afghanistan is almost unrepairable. While all these problems are very sad, the absolute worst part of the situation is the ongoing corruption in the Afghan government. The USAID, United States Agency for International Development, has stated many times on their website how much they are improving the situation in Afghanistan. But in studies by the World Health Organization, these remarks have turned out to be false. The reason for this discrepancy is the Afghan government. A newscast on the channel Al Jazeera, a Middle Eastern news group which broadcasts in English, talked about this very problem. On one of their newscasts, they had an American humanitarian, one of the lead members of Doctors Without Borders, and the head of the health department of Afghanistan. Many sad truths were unearthed during this newscast, which exposed the Afghan health department for what it is, fraudulent. In the newscast, the anchor brought up the recent incidents which involved one of the newly built hospitals. To run the generators, the aid agencies had donated money to pay for the barrels of diesel. The news anchor then stated that the Afghan government had apparently paid hundreds of dollars of this money for each barrel, while each barrel usually costs around $50. In the newscast, a member of the Doctors Without Borders uncovered many shocking realities about his travels, like when he visited a town which was supposed to have been funded by the USAID, but still did not have any adequate healthcare services. When looking around, he found a cache of expensive healthcare machines laying in a basement, untouched. Not only do the agencies have to deal with government corruption, but they also have to deal with distribution. Even if these machines are properly distributed, the undereducated Afghan doctors would not be able to use them due to lack of knowledge on how to use such devices. Afghanistan is not solely responsible for the corruption. The U.S. government and the USAID are also responsible for their own form of corruption. Christopher Stokes, the general director of Doctors Without Borders, said this on an interview on Al Jazeera about the topic.
These projects were done as kind of high visibility projects. I went myself into the hospital in Lashkargah, a boost hospital, and if you go in the basement, it's full of expensive donations from Western governments who were keen to put these products across and have a good image in the community, but they weren't necessarily what was needed in the hospital. So you have very expensive x-ray machines, scanners, etc. that have been donated. So you also have to look at the kind of assistance that's been flowing in. So you have a combination of sometimes cynical healthcare projects conducted by Western forces which had military objectives.
All the negativity revolving on the idea of healthcare in Afghanistan, the future may seem a little bleak, but there is still hope. There are many agencies around the world who are taking a different approach to this problem. For example, the British Red Cross is focusing on other areas besides money. The British Red Cross, instead of focusing on Afghanistan as a whole, are focused on a smaller area. This allows the British Red Cross to more closely control how the resources are used compared to something like the United States Agency for International Development, who focus on the country as a whole and have much less contact with the people who are trying to help. Next, the British Red Cross is focusing on educating the people instead of pouring money into the country. While Afghanistan obviously needs more hospitals and new medical equipment, they don't have nearly enough people who have the knowledge to use these devices. The British Red Cross sees this problem and therefore focuses first on education. This education is not just for medical personnel, though. It is for the general populace. As I mentioned earlier, the lack of medical knowledge can severely harm the general populace. For example, the pregnant woman who was strangled when she was having seizures because of her tribal doctor thought she had evil spirits in her. Communities like these will benefit greatly from these programs. This education the Red Cross is giving will be life-saving for countless people in Afghanistan. The problem of healthcare in Afghanistan is a pressing one. There are so many factors that weigh against the institution in Afghanistan that it is hard to say it will ever recover. With help from foreign aid, doctors, and workers, the problem will be solved. I'm Brendan Doyle, and thanks for tuning in tonight.